instructions either to the patient on how to use it or administer it, or instructions to the pharmacists or the pharmacy, including pharmacy technicians, on how to compound it. Can you follow? If the prescription is ready-made, if the drug is ready-made, this is an instruction to the patient on how to take it. Okay, but prescriptions can be sent to a pharmacy, which we've been talking about, the different settings, right? Specialty pharmacy, wherein they have to compound it. This is where your abbreviations come into play. Right? PRN stands for as needed, from the words prore nat, for acute pain. The doctor specified that. I hope all doctors write this way. Pretty. Okay, but that's not real case scenario. But one of the things that we've done, part of the regulation is, especially in hospitals, doctors have to input it on the computer to avoid medication errors or misreading of those prescriptions. One of these rules is to write the words microgram and write the words milligrams, and not just use mg or mcg. TJC, which stands for the Joint Commission, is the accrediting body for hospitals. They check for everything. Of course, they set up rules on how to prevent this medication errors. They're called the Joint Commission. If you work in the hospital, they're going to say, oh, we're going to be audited. And usually the ones that audit them, the organization is called TJC, the Joint Commission. They're going to say, oh, the commission is here, or TJC is here. When you hear that, that means they're going to be audited. It's an organization that checks for the quality of the service or patient care that hospitals have. They even check the menu of the cafeteria, what staff eat. Yeah. They check everything. So you want everything spick and span. Okay. So TJC sets up regulations on minimizing medication errors. Hint, hint, wink, wink. There's another organization involved in that, which will come up on both PTCE and final exam. ISMP, Institute for Safe Medication Practice. They have set up all this do not use list. Okay. Together with TJC combination, the goal is to minimize medication errors, because it's easily misinterpreted that MG can be, or if the doctor meant micrograms, but you read it as milligrams, or whoever is dispensing or filling that prescription, that's a big problem and a big mistake, because that's 1,000 times overdose. The primary organizations for helping minimize medication errors by setting up regulation. Okay, so Institute of Safe Medication Practice.